One of the most common problems that affect active women is anterior knee pain. It can come on suddenly without any injury and can cause a lot of disruption to activities of daily living and sports, and it can even cause pain at night. Anterior knee pain is pain that occurs at the front and center of the knee. Women are predisposed to this type of pain because of a combination of anatomy and muscle imbalances. The extensor mechanism of the leg that helps bend and straighten the knee includes the femur, or the thigh bone, tibia, the leg bone, and patella, the kneecap, working together with the quad muscle and tendons. Every time you put weight on the leg or flex the quadriceps, it engages the mechanism and the joint between the kneecap and the femur gets compressed or loaded. The other muscles that play a key role in optimizing hip and knee function include the gluteus muscles and hamstrings, as well as the IT band, which is a thick band of tissue and muscle that run on the outside of your leg between the knee and the hip. Women have wider pelvises and tend to be more knock-kneed than men. This anatomy predisposes them to anterior knee pain for a few reasons, including abnormal kneecap movement over the front of the knee, over-tightened soft tissues on the front or side of the knee, and quadriceps dominance, relying primarily on the quad muscles for all loading activities. Flat feet can exacerbate this issue further. In addition, women may have weaker posterior chain muscles, which include the glutes and hamstrings. This causes two things: pelvic instability, which can impact leg and knee alignment and function, and over-reliance on quads for all weight-bearing activities. The symptoms of anterior knee pain include the following: increased pain in the front of the knee with activities like going up or down stairs, kneeling, squatting, lunging, running, and jumping, difficulty fully straightening the leg, pain with prolonged sitting with the knee flexed, especially if the feet are dangling, pain while sleeping at night. It can also present as pain in the back of the knee, vague and achy in nature but can be burning or sharp with loading, popping, crunching, or grinding in the front of the knee when bending or extending the knee. When these symptoms are present, an orthopedic surgeon will examine your glute strength, hamstring, and IT band flexibility. He or she will examine your kneecap for tightness or hypermobility and evaluate for grinding or popping under the kneecap when the knee bends. In addition, he or she will look for signs of pain around the IT band and kneecap at rest, as well as with flexion and extension. There are usually no signs of joint swelling, instability, numbness, or tingling with this condition. Treatment of anterior knee pain does not typically require surgery. Conservative treatment methods may include activity modification, physical therapy, and anti-inflammatories. In rare cases, when underlying structural abnormality leads to persistent symptoms, surgery may be necessary. Recovery from anterior knee pain is generally successful as long as the patient adheres to the rehab protocol, which usually involves both a combination of activity modification, so not doing the things that make it hurt, and sticking to the physical therapy protocol, both with the therapist and at home, specifically focusing on things like core strengthening, glute strengthening, hamstring strengthening, and stretching. And as long as those things are followed, then usually by about 2 to 3 months, people are feeling better.